Welcome to our website. I'm Dr. Eric Marchant. Self-image is related directly to our self-confidence. When we are confident, we feel better at work, enjoy being in social situations, and are more comfortable in our personal relationships. Even a small physical change in your body can be a major improvement in your self-confidence. My greatest satisfaction is when I can make a patient happy about their appearance, sometimes for the first time in their life. Because plastic surgery can make permanent changes in your body, you're making a serious decision. I hope you will find many answers to your questions during your virtual consultation. Please feel free to contact our office for an appointment for even more information. Welcome to the liposuction portion of your virtual consultation. I'm Dr. Eric Marchant. As we get older or become more sedentary, small pockets of fat may begin to deposit in hard-to-eliminate areas, especially at the hips, stomach, or thighs. Liposuction is a surgical procedure that removes fat deposits that cannot be resolved by diet or exercise. But it's important to understand that liposuction is not a substitution for diet or exercise, and that the amount of fat that can be safely removed has limitations. If you have questions about your liposuction, your virtual consultation will be very helpful. Please feel free to contact our office for an appointment. The best candidate for liposuction is someone who is reasonably fit with problem fat deposits that won't get resolved with exercise or dieting. Best results are when the skin has not been stretched or lost its elasticity. Well, typically, liposuction can be performed on the hips, inner thighs, saddlebags, and love handles. But literally, it can be performed anywhere there is a problem fat area. There is usually more than one problem area, and we will discuss it in detail at your consultation. Depending on your age, the skin will react differently. The skin will retract more easily in younger patients. Loss of elasticity can cause drooping of the skin, and you may need to consider a lifting procedure. These questions and options will be discussed at your consultation before your surgery. Well, not all fat cells are removed. Some are left behind. If you gain back the weight, the result can be a ripple-looking effect in those areas. It's a very good idea to get into an exercise program and to control your diet to keep fat from returning and to keep you looking your best. Most patients can begin aerobic exercise in about a week. In 3 to 5 days, you are back to doing normal activity. We will monitor you during your entire recovery. You will get a phone call from me the night of surgery and a phone call the next day. You will see me in about 5 days, then on a weekly basis for the first few weeks until the healing and results become more permanent. I'm always available for any questions or concerns. It's very important to take ownership of your procedure. The more that you participate in your recovery by following exercise programs, applying creams and lotions, and performing massages, the more successful and permanent your new appearance will be. You can go back to work in a few days depending on the type of work you do. If there is heavy lifting, obviously it will take longer. As far as discomfort is concerned, liposuction is the most well-tolerated of all the procedures. Most patients describe postoperative discomfort as a muscle pull or ache from exercise. Well, expectations are affected by how well you are informed. I invite you to set up an appointment and come to the office. We have a great deal of information and computer-generated material for you to see. We have before and after pictures and testimonials from other patients that will help you better understand your procedure and your results. There will be small scars about 1/4 of an inch at each entry site. The incisions are placed in the least visible areas. Every effort is made to hide these incisions and skin creases and to disguise them wherever possible. We will recommend skin creams and methods to minimize scarring. In most cases, you can go back to the gym or begin aerobic exercises in about 1.5 to 2 weeks. The length of your liposuction will vary depending on the amount of fat removed and if there are multiple problem areas. The liposuction results can literally last forever, provided that you maintain your exercise program and your diet so that fat is not redeposited in the problem areas. In general, your clothes will fit better. As far as fitting into smaller sizes, it will depend on how much fat is removed and from where the fat is located. Liposuction removes fat deposits that are located in problem areas. If the skin is stretched too much, we may have to discuss a lifting procedure in addition to your liposuction. At your office visit, we can determine all of your options.